Hello there, and welcome to Lecture 2 of the Introduction to Psychopathy course. This second lecture is entitled Representations and Preconceptions of Psychopathy. Throughout this lecture, you will be able to distinguish between the way psychopaths are portrayed in the media and the news, and how psychopathy manifests within the real world, and begin to understand the traits and behaviours which are associated with psychopathy, specifically offending behaviour. In terms of psychopaths in TV and the film, here are just a few common media representations. We have Hannibal from both the TV show and The Silence of the Lambs, Dexter Morgan, The American Psycho, and Norman Bates from Bates Motel. Such individuals are clever, cold, and calculated, but most of all, they are oftentimes the main character of the show, and as such are deemed to be very likeable. Now compare this to how psychopaths are portrayed in the media and the news. Here are just a short collection of newspaper cuttings from UK newspapers. The one on the far right talks about Ian Brady, a psychopath. They refer to him as a monster. Brady is dead. In the bottom right, we say that those mentally ill patients commit so many crimes, so many murders. We also refer to those with psychopathy as going on rampages. Key terms is that we refer to them as being mentally ill. Think back to lecture 1 where we talked about some of the classical definitions of psychopathy. We also refer to them as monsters. We dehumanize them. We think of them as an outgroup, as others. They're portrayed as being injured in some capacity, be it physically or mentally, again referring to those early conceptualizations. But most of all, in the media, psychopaths are referred to as being dangerous in some capacity. This doesn't just stem to psychopathy, but talks about mental illness more generally, for a review of which you should consider Varshney et al. 2016, with the citation at the bottom. In Varshney's review, they discuss a relationship, or at least the absence of a relationship, between mental illness and aggression and violence, and suggest that although in some cases this can be true, on average there is no causal relationship between having a mental illness and conducting violent behaviour. This is important when discussing psychopathy more broadly. For the second activity of this course, I want you to consider the way in which TV, film, and the news describes an individual who has psychopathy. What differences can you see? And we've talked about a few of them briefly just now. You should aim to spend 5 to 10 minutes on this, but you are also welcome to conduct your own internet search for other examples should you so wish. Please make a note of these and reflect throughout this and the remaining lectures. You can pause the video now and start it again when you're ready to continue. So having talked about mental illness and offending behaviour more broadly, let's now turn our attention to psychopathy and offending behaviour more specifically. In 1998, Robert Hare said that psychopathic traits do not guarantee an individual to come in contact with the criminal justice system or offend at all. However, such individuals with psychopathy are at an increased risk for committing acts of crime and violence, with such prevalency rates noted in the following slide. So if we were to reflect now back on Hervey Cleckley's criteria for psychopathy, let's look at some risk factors which may lead an individual to committing offences. Such risk factors include egocentricity, grandiosity, impulsivity, and poor behavioural inhibition. Such individuals lack empathy, emotionality, fear of crime and punishment, and also the guilt to reflect on their actions. When psychopaths do go on to offend, they are 3.5 times more likely to offend in a violent manner compared to those without psychopathy. Moreover, when such individuals commit murder, these acts are predominantly predatory or premeditated in nature. So what does that mean? It means that individuals are not acting impulsively or driven out of emotion. Such reasons for offending may include material gain or considered retribution, so not impulsive acts of revenge. In this case, revenge really is best served cold. When breaking psychopathy down into affective and interpersonal components, offending behaviour is better predicted by the antisocial behavioural components rather than these affective and callousness components. But these are matters which we'll be discussing in the following lectures. So, if the literature is telling us that we can predict the occurrence of violent crime, even murder, as a function of a diagnosis of psychopathy, then this leads us to several key ethical discussions. First, if we question that psychopathy is a predictor of crime, though we appreciate that this isn't all the time, and as such can predict risk and future dangerousness of those individuals to offend, should we be using it as a prosecution tool? Simply put, if an individual scores high on the measure of psychopathy, should this be enough to warrant a conviction, even if that individual may or may not go on to commit further crimes in the future? We know that not all do. Second, and stemming from the work of Lloyd, Clark and Forth in 2010, we know that psychopathy scores in a criminal justice setting are directly related to the individual's perceptions of dangerousness and the inability to treat an individual who has psychopathy, whether this is right or wrong. As such, a score on the psychopathy score can dictate the trial outcomes, or at least predict them. And as such, how do we ensure a fair trial in this background? Can we even ensure a fair trial? And what are the pros and cons of doing this? Third, staying in a court setting, should we be considering these social, biological, or psychological explanations of psychopathy as mitigating circumstances? Now, this will be talked about more in Lecture 8 when we talk about the biopsychosocial model of psychopathy, but it's worth bearing in mind now in terms of these ethical discussions. If an individual is predisposed or things have happened in their life which has led them to be a psychopath and as such has led them to commit such crimes, should we even be reducing their sentences or directing treatments to try and re-secure this in their lives? Throughout this lecture, we have explored differences between the way psychopaths are portrayed in the media and the news, and what some of the reasons for this might be. We have also gained a better understanding of the relationships between psychopathy and offending behaviour. And moreover, we have started to critically evaluate key ethical debates within the field of psychopathy. Even though the research is there, it's not always clear-cut, especially if we go back to the key take-home message from this lecture, in that although psychopathy does predict violent offending, even murder, this isn't always the case, and so a ruling for one should not apply as a ruling for all. Moving on to Lecture 3, we'll be looking at more of the in-depth measures of psychopathy, both in forensic and clinical, and also the general population settings. I hope you can join us for that.